This conference will now be recorded.
Good afternoon, everybody. Thanks for joining me on today's Allscripts training call. I appreciate you taking the time in what I know to be very busy and getting busier schedule. So thank you for that. As a reminder, we are recording this session. So if you could take a moment and make sure that your line is muted. You want to make sure that the red icon in the GoToMeeting application it's red with a line through it. That's how you know that you're muted. If it's green, then you're not muted. So take a minute to make sure you mute your line. If you have questions while I am presenting, if you could use our chat feature in GoToMeeting, it looks like a little discussion bubble. You can click on that and then you can post any questions that you have there, and then I will answer those at the end of our session. As a reminder, in our new training workflow, on Tuesday, Wednesdays, and Thursdays, we're going to be learning new content and doing our training like we've seen over the last few weeks. But on Fridays, we're going to open it up to a question-answer session. So come prepared with questions tomorrow. We're going to have you put those in the chat, and then I'll work through each of those and show you the answers to all of your questions that you have. We are asking that we keep those two topics that we have already discussed. It could be a little bit of a Pandora's box if we're opening it up to new workflows. We want to make sure that we have ample time to show you what that workflow is going to be like. So if you have questions about how workflows interact with one another that we've already discussed, maybe getting stuck on little pieces in terms of what we've already been through, let's talk through that tomorrow at 3 o'clock, and we'll make sure that we get your questions answered. So I am going to launch our application here by clicking on our shortcut. It's going to take us to our cloud login. We're going to choose sign in. We're going to launch our mountain folder, and I'm going to click on that. Before I go past this screen, though, we are changing our hosted environment, and so that this weekend. And so as early as Monday, this folder might have a different name. It might say OCC on it, maybe OCC MSO. So if it changes, don't be alarmed by that. That's still going to be our link to get to OCC's site. We're just moving to a dedicated hosted environment, which just means that the servers will be designated to OCC specific. So I clicked on my mountain folder. I'm going to click on my clinical module. And here I am connecting through a remote desktop to get to our green screen. As a reminder, our green screen is our login to our application. And so as it launches here to our green screen, we can put in our username and our password, our Allscripts #1, and log in. While it's doing that, in case you were wondering, as we are moving into our dedicated hosted environment, our workflow does not change, our logins do not change, our passwords do not change, and so everything will be the same. The only thing that you might notice that might be a little bit different is that mountain folder will be renamed potentially as we change to our new dedicated hosted environment. So here we are on our desktop view, and this is what we see when we log in. Yesterday we went through our surgery scheduling process. So what it looks like when we are in a patient's chart, we order the we order the surgery, we put it into future orders, and then what it looks like in our documents when we go to our print, in our print packs, what it looks like, how we could add to that, and then what it looks like in our output queue and how we can use this process as our tickler system to make sure that all of the surgeries that our physician orders, we're making sure to schedule and reach out to those patients. So as a reminder, when we are in here, in our output queue, if we double click on this order, remember, if we use any of these action items up here, these first 4 items, it's going to take that, that order off of our queue. So we want to use this as our record keeping system to keep us and record our workflow, keep us on track, make sure that everybody can log in and see where we are in our process of scheduling the surgery. But if we're going to send something out, that we do that through going through the chart and accessing the document in the patient chart versus doing it through our output queue, so that we can keep that in our system. The other thing that we walk through is what happens if we accidentally do take it off of our list. How do we go in, create that order again, and then make sure through our output templates, and then make sure that we are queuing that. So if you missed part of that yesterday, please go back and watch the training video. I sent that out to you guys last night. If you did not receive that video, please reach out to your division leader so that you can access that training video from wherever your division leader is saving those on your network. So I'm going to go back to our appointments. This is what we normally see. Today we're going to talk about our Xray workflow and what that looks like for our Xray techs and what that looks like for our acknowledgments that those have been ordered, how we're going to know when they've been done, and then what that is going to look like with our interfaces with our PAC system, our internal PAC systems for our X-rays. So I'm going to launch our patient. I'll look up our patient here, make sure that we choose our search training patient and go to search. I'm going to launch our training patient and go into our encounter. So here we have our face sheet. This is what we default to as a reminder. This is what we default to when we sign into a patient's chart. We're going to go through this process assuming that we have done our reason for visit, we've done our vitals, our history, our review of system, and if we have if we have an X-ray process already established in our office, and the medical assistant is going to be ordering those X-rays before we pass that along to the physician. That's the operational understanding that we're going to move forward in this example. If you have a different workflow, we can talk about that a little bit tomorrow in our question and answer session if there's something specifically that doesn't meet your workflow in regards to this. So I'm going to go into our assessment and plan. I'm going to go to My Short List. I'm going to go to Xray. And I am going to go to our hand template, our hand X-ray, and double click on our X-rays. Down here, we'll see that our X-rays have a little house in front of them, the blue house. That blue house indicates that it is done in-house, and that's what our X-ray options will allow for us to have as we build those. We're going to, once we have that built, if we double click in here, you'll see we have that this check mark in-house has been selected, and that will default. That's how we know that it is defaulted, because it is that's what makes it a blue house. So if you choose one of these options and you drop it down here and it does not have the blue house on it, you want to make sure that you change that and you double click on it, and that you click this in-house check mark. So we talked a little bit about this before. What happens if we don't have a diagnosis already specified for this visit? That's okay. You'll see that it's at an unspecified diagnosis. And that's okay, because when our provider chooses the assessment, we're going to drag and drop that over where it says unspecified diagnosis, so it's not going to impact our ability to order an X-ray. So here in our X-ray, we've ordered this. If I go back to my desktop view, when we have our schedules listed here, one of the things we talked about was our status and our room tracking mechanism. And what we can do is change our status and room tracking to allow for X-ray. And you'll see that as we put that in there, it would change it to be, it would change it to a red icon. I'm going to show you what it looks like, however, and force an appointment in here. However, this is not how the workflow will look in terms of our appointments. Our appointments will be pushed from our practice management system. But just so that you guys can see what this tracking looks like, I'm going to show you. I'm going to show you what it looks like. And I'm going to put appointment for 3. But I made that the wrong time. So bear with me. I'm going to try that one more time because I changed that, put that for the wrong date. Click OK. It doesn't look like it's pulling through for me. So we will we'll go off topic here or off the cuff here, and I'll explain to you what it's going to look like. Sorry about that. Hopefully we can get that worked out for tomorrow. Under the tracking room and status, we talked about how it will say ready for provider, ready for X-ray, ready for medical assistant, whatever that is. And there'll be a red box that populates right here, and that will identify to our X-ray staff that they're ready for X-ray. The red color will be the notification to our X-ray staff. So when it happens there, if we go to our procedure orders, you'll see that we can do our filter, much like we did with our surgery scheduling. We could build our filter, but we're going to choose our location. We would pick this to the location that our X-ray staff is going to be working at for that day. I'm going to default it to all locations. We have it for we could choose it specifically for a specific caregiver. Again, like we talked about yesterday, this will be our ordering caregiver, not the provider that's associated with the encounter. So that might be very difficult to identify as we work through this, that you would have to be able to look through each of those medical assistants, physicians, PAs that would be in clinic ordering things. So I recommend that we keep that at all caregivers, and that you filter your options by choosing your location. So you can choose under performs. We want that to be in-house. That's going to allow us anything that had that blue house icon before our order, it's going to that's what's going to pull in here, and that will be just our Xray orders. We want to say all patients because we want all patients to pull that have had an in-house order. And then because we're going to do the Xray today, we want to make sure that anything that's ordered today, that's what we see as our tickler system, much like we talked about for these options in our surgery scheduling. So I'm going to choose this as my filter. I'm going to set my filter to filter 1. It's going to ask me what I want to name it. I'm going to click OK. Now, if I go here to filter, you'll see that my Xray workflow is here, and I could click on that and it would set my parameters for me. If this is what I want to see every time I go into the Xray, I'm going to choose my Xray workflow and set that as my default. So some of the things that we would change in our filters, if you are an Xray tech that goes to many offices, you might have one for the Swedish location, one for the Lincoln location, and one for the Inverness location. If you go to 3 locations, and then and you could toggle between those depending on what location you are at for the day. But that's how you could use the filters. So you'll see here, this is the Xray that we just ordered here that's listed. If I use my caret here, you'll see it will give you the option. I'll show you what I ordered. So that's how we will view it. If I click on the order, the Xray itself, the one with the CPT code here, the 73120. If I click on that and then I choose this create requisition up at the top, it's going to launch our requisition screen. Our requisition screen is going to be how we push our order from Allscripts to our Xray PACS system. So if you have ERAD, or if you have MedStrat, or if you have Merge Quattro, those options will be listed here as we go live. Each of those interfaces will be turned on. You're going to choose under requisition, your performing facility. You're going to choose this down caret, and then your facility, your interface, so whether it's MedStrat, ERAD, or Merge Quattro, will be listed here, and you'll choose the appropriate PACS system that you want to push this to. And again, this is our Xray text that's doing this piece of it. They're going to make that choice for the appropriate PACS system, and then they're going to click OK. And when they do that, what's going to happen is that this patient is going to push to the PACS system, and it's going to fall off our to-do list here. So we're going to know that that was already completed. If we want to take a look at the face sheet, maybe there's some additional information that we want to put in there, we could go here to our face sheet, our little smiley face, and we could look up any additional information. Maybe we want to see if the patient has had this Xray before. We could go into our orders, our previous orders, and look at those. And it will launch this for us. If the patient determined that they were that they wanted to decline the Xray, we order the Xray. Maybe we find out in our screening questions that the patient could potentially be pregnant, and so we're not going to complete this order. We would communicate that with our medical care team and let them know. And then we could also double click on our order here, and there will be an option for us to decline our procedure so that we wouldn't push it to our entity. We could decline it. And if that's the case, we could then go back to our patient view, go to our assessment, and make sure that we either clear this. This will clear everything, but that we could either remove it, or we could go into our Xray and we could say patient declined. due to pregnancy, and then we could click OK. And that will populate on the patient's chart. If we do that, when we are signing off on our chart, we would want to make sure if the patient has declined that our dollar bill is turned gray so that we don't bill for that. So again, the way that we did that, our workflow is that we are going to go into our medical assistants would order our X-ray. Our X-ray techs would be looking at our desktop. They would be identified. It would be identified that the patient was ready for X-ray by the tracking system turning red. It would say, "Hey, this is ready for X-ray." Our X-ray tech would then come into the procedure orders. They would see the order here. They would choose the down caret so that they could see what the order is. They would double click on this. They would change their performing entity to the PAC system that your division uses. And then we would hit OK for it to fall off of our to-do list. After the X-ray has been completed, the X-ray technician would go back to appointments. We would right-click on the patient. We would choose Edit Tracking Status. And then it would give us the pop-up option for us to change that from the red square that will populate to the green square, which would identify ready for provider. So that's how it will get from our medical assistant to our X-ray techs and then back to our providers, and signaling that the X-ray has been completed and that it's ready for the provider to see the patient. So we don't have any questions in our chat, although we are ready for our questions. If you have any questions, please jump on that chat and enter your question, and I will answer them as we go here. So our first question is, will you be able to see what time the X-ray was ordered so that the techs know who to go to first if there are multiple X-rays ordered? So the answer is that would be, you could do it one of two ways. You can choose to view your appointments by time. You'll see the designation of the column by where the caret is. And so you could have, some divisions might determine that they want to work their X-rays by time of appointment. And if that's the case, then you could track it by that, and they would go in order from when it turns red in the time order. If we determined that we wanted our workflow to be in the order that the X-ray was put up, then you could do that by your checked in or your started status. If I expand those, you can see that my caret will change here depending on which column I choose. And then it would determine the first one's checked in or the started, which would mean that that's when the medical assistant has started the intake process, and you could balance it from there. In our procedure orders here, you can see that it has a date, but it doesn't designate it by time. So unfortunately, it wouldn't be identified in our procedure orders in the order that the X-rays were put in. Unfortunately. Another question: if the doctor wants a specific view with the X-ray they ordered, do they put that under the comments? So yes, you can see here we put in our comments patient declined due to pregnancy. So anything that we put into our assessment and plan workflow, I'm going to go back and toggle to our patient view. Under assessment and plan, if we were to put, instead of that patient declined due to pregnancy, you could put that special view. You'll see that it's identified here. It will show up in the patient's note. So we want to make sure that that's identified, that if we put it in that comment section, it will populate in our patient's note. But if I go back to that desktop view, pull my procedure orders, then I use my caret to look at what was ordered, you can see that that comment follows the order. So we could identify something specific that a provider wanted. So that is all the questions that we have in our chat right now. I will stick around until 3:40 on our chat. Please feel free to ask any questions that you have. Join me there. Again, tomorrow is our question answer session. So play with this system, play with our surgery scheduling processes that we learned yesterday, and come prepared to ask questions tomorrow. We will have 30 minutes designated for that, for anything that you are unsure of that we have covered so far. So thank you guys for your time. I'll again stick around on the chat to answer any additional questions, and I will see you all tomorrow. Thank you.